Usually, carbonated drinks are sugar-sweetened beverages. Regularly, soft drinks include carbonated and non-carbonated beverages, which are usually sweetened with high fructose corn syrup or sucrose. These beverages have relatively high calorie and sugar contents, but no or very small amounts of other nutrients. The consumer also needs to be careful of other names of sugar because they also use other names rather than just sugar names. So as a consumer, we need to know another name of sugar. For example, beet sugar, corn syrup, dextrose, fructose, glucose, high fructose corn syrup, maltose, maple syrup, sucrose, and syrup. So how carbonated drinks can cause diabetes mellitus? First, soft drinks are often high in sugar content and acidity. Each gram of sugar contains 4 calories. In addition, they supply energy, only and are of little nutritional benefit. The high content of sugar and acids, which have carcinogenic and acidogenic potential, can contribute to dental caries, to erosions, as well as contributing to health effects, such as overweight and obesity, and may be associated with an increased risk of type 2 diabetes. Second, some of these drinks contain high amount of rapidly absorbed carbohydrates such as sucrose and high fructose corn syrup, a key ingredient in some sugar-sweetened beverages. This type of carbohydrate can lead to hepatic lipogenesis and high dietary glycemic load, resulting in inflammation, insulin resistance, and impaired B-cell function, thereby fueling the development of type 2 diabetes. So, what association of fructose and diabetes? A 2016 review suggests that fructose may contribute directly to diabetes. The liver absorbs fructose without regulating the intake, which could lead to a build-up of liver fats and a decrease in insulin sensitivity. Low insulin sensitivity could lead to a build-up of liver fats and a decrease in insulin sensitivity. Low insulin sensitivity makes it harder for the body to remove glucose from the bloodstream, potentially leading to type 2 diabetes.
These are 10 brands of the carbonated drink that were chosen by us. We classified them into 3 groups based on their type of sugar use. 100 Plus, Mirinda, and Kickapoo only use sugar or sucrose. Furthermore, Sprite and Vida Vitamin C is in artificial sweetener group as it uses sucralose, acesulfame, K, and aspartame. Moreover, Coca-Cola, 7-Up, Fanta, A&W, and FNN use combination of the artificial sweetener and the sugar. The graph shows the value of total sugar per 100 ml in 10 different brands of the carbonated drinks. Based on the bar chart, the carbonated drink brand Vida and Sprite that contain only artificial sweetener have the lowest total sugar values, which is less than 4 grams. It is because artificial sweeteners are much sweeter and very few calories than regular sugar. So, only small amount needed to achieve the desired sweetness. While carbonated drink Kickapoo and Mirinda that from sugar categories indicate the highest value of the total sugar than others. However, the 100 Plus only contain 4.9 grams per 100 ml of sugar content, which is low even it only contains sugar. The reason is main sweetening ingredient in 100 Plus is the combination of the sugar, which are sucrose and glucose syrup at the lower level. The use of both artificial sweetener and sugar in the carbonated drink is to achieve sweet flavor and minimizing the overall calorie intake. Recommendation per serving for diabetic patients recommend sugar intake is less than 10 grams per day. WHO 2015 guidelines recommend that free sugar intake should not exceed 10% of calories per day. Sugar intake for less than 10% is about less than 45 grams per day. If we take 1/3 of sugar intake for beverage, we can only drink sweetened beverage less than 50 grams per day. So we can recommend for A to drink carbonated drink from brand Sprite, 7-Up, 100 Plus, Vida, and Fanta, which their total sugar value in one serving below 15 grams.
Drinking soft drink can have several implications to health depending on factors like frequency of consumption, quantity, and daily lifestyle. Drinking soft drinks regularly can cause unhealthy weight gain, which will lead to being overweight or obese. This is because of the high amount of carbohydrate and total sugars present in soft drinks. Soft drinks also can cause dental problems as the high sugar content in soft drinks can lead to tooth decay and cavities. Additionally, the acidity acidity of many soft drinks can erode tooth enamel, leading to dental erosion and sensitivity. This type of drink also can increase risk of diabetes mellitus due to high amount of total sugar that lead to insulin resistance over time. Excessive amount of sugars in this drink can cause dehydration. Consuming this drink in large amounts regularly can definitely affect kidney health. Soft drinks also contain little to no nutrients for health. It adds nothing to diet except excessive amount of sugar and calorie. It also increases risk of gout, as there is a long-term studies tied sugary soda to a 75% increased risk of gout in women and an almost 50% increased risk in men. Sugar-sweetened beverages lead to rapid spikes in blood sugar, which can lead to dementia, as there is research show that any incremental increase in blood sugar is strongly associated with an increased risk of dementia. Excessive consumption of sugary beverage has been associated with an increased risk of depression and other mental health issues. This may be due to the fluctuation in blood sugar levels and the impact of sugar on brain chemistry. Some studies have suggested a possible link between the consumption of certain artificial sweeteners found in diet soft drink and an increased risk of certain cancers.
Let's take a look into how to limit sugar intake. First thing first, choose natural sweetener over artificial sweetener. Second, always check the nutrition labels on the beverage packaging. After that, pay attention to the portion size. Go for the smaller size instead. Not only that, we should also choose plain water as primary beverage. Last but not least, dilute the sugary beverage with water to reduce the sugar content.
For healthier choice suggestion, ada 6 recommendation yang I would suggest. First, Salsa water, which is frizzy, sugar-free alternative to the other commercial brand, which is also free from sugar, carbo, and calories. Second, herbal tea. It is free from any carbo, calories, and sugar also. And it is also rich with disease-fighting antioxidant, which is flavonoid, carotenoid, dengan phenolic acid. Yang ketiga, unsweetened coffee, which help in lowering the blood sugar level and reduce the risk of type 2 diabetes mellitus. Yang keempat, milk. The fat contained in milk has a little impact on blood sugar level, but it is actually can slow down digestion, absorption, and which will lower the level of blood sugar rise. Yang kelima, sugar-free lemonade. Sugar-free lemonade ni low in carb beverages, which is easy to make at home with just simple ingredient, which is lemonade dengan air. Yang keenam, kombucha. Kombucha is a fermented beverages made from black tea or green tea, which rich in probiotic. Probiotics will improve the blood sugar level, especially for type 2 diabetes mellitus people.